Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations Tonight with Marty Ross MD. In this webinar, you create the webinar with your questions, and I try to provide the answers to the best of my ability. Sometimes I do get stumped, but hopefully not too many times tonight. It's kind of a smaller crowd tonight, which is okay. I'm actually only going to be able to be with you for about an hour tonight instead of the scheduled hour and a half. I'm actually starting to come down with a little bit of something, and I think I'm going to take care of myself, but I'll be with you for about an hour or so. And yes, I'm doing my own recommendations that you see on my website to keep this from becoming something more. And they usually work, so I'll probably be okay. Anyhow, let's go ahead. Oh, and for those of you that are new here, the way that these webinars work, you get to write questions to me. And to do that, what you're going to do is you're going to wind up writing your questions in the chat box. It's over there on the right lower side of the computer screen. I ask as you write the question to me that you only hit the enter key one time. Each time you hit the enter key, it sends a question to me, all right? And that gets to be hard to put together on my side. Because partly what I'm going to be doing while we're doing the webinar tonight, I will be displaying your questions. So those of you that are here during the live webinar will be able to actually see that question. You'll see it posted on your screen. For those of you that are watching a recorded version of this tomorrow or in the days after, you won't see the questions, so I will be reading them as well too, okay? Tomorrow morning, you will get an email from me saying that the recording from tonight's webinar is ready when I get it ready, and I usually have that out to people by around 6 or 6:30 in the morning, all right? So that's Seattle time, so Pacific Standard Time. All right, and so with no further ado, let's go ahead and get started here. Let's see, this first question is from Sarah. Hi, let's see. Hi, Sarah. Hi, Dr. Ross. Are the herbs completely safe to use even if Lyme and or co-infections are not confirmed? Thanks for all you do. I mean, it depends on what you mean by confirmed. Okay, so first of all, so when you have Lyme disease, the Lyme infection, you can also, the tick that gave you Lyme can also give you co-infections, all right? So you can have Lyme, and the co-infections are, the major ones are Bartonella, Babesia, something called Ehrlichia, and something called Anaplasma, all right? The testing for Lyme will find Lyme about 80% of the time to 85% of the time. And ultimately, Lyme disease is a clinical diagnosis, and we make the diagnosis of Lyme based on considering four things. One is, what's the risk of getting it? So if you've got a job that puts you in proximity to ticks, for instance, like you're a Forest Service worker and you've had ticks near you or you've seen them, well, that's high risk, even if you don't remember having a tick bite before, okay? Or people in New Jersey that get tick bites where about 95% of ticks carry Lyme, that's high risk, all right? But not 50% of the time that people have Lyme, they don't remember a tick bite. The other thing we consider is, what do your symptoms tell us? Third thing, in other words, are they consistent with what Lyme would look like? Third thing we look at is, are there any physical exam findings? And then finally, the fourth thing is there a supportive test? Now, notice the word I used, supportive, okay? So a test doesn't diagnose an illness. We have to still think, does this test make sense relative to what's happening with the person? So you can make a Lyme disease diagnosis without positive testing, all right? When it comes to a confirmed Bartonella or confirmed Babesia, it's not always possible to confirm it. And that's because Bartonella, we estimate that co-infection that there are 30 different strains, and there are only 2 that we can actually detect with testing. All right, so I mean, you can have it and not have testing that shows it, all right? And Babesia, which is a blood parasite that lives inside of your red blood cells that you can get from a tick bite, there may be about 15 to 20 strains of that, and we can only detect 2, okay? So for that reason, I make decisions about whether somebody has Babesia or Bartonella based on the symptoms, okay? And I'm not going to belabor what those, I'm not going to go through what those symptoms are now. I'll show you how you can find it on my Lyme disease information website. But when you're raising the issue of confirmed here, what I would say is you don't necessarily have to have confirmed by a test to be able to diagnose, okay? So that's one part. All right. Secondly, and I'll do a screen share here in a minute to show you some articles to take a look at in the Treat Lyme book. All right. So then, are the herbs safe? And that would be if you have the germ or don't have the germ. All right. So, anything we put in ourselves that kills things, that kills germs, is a toxin. I mean, prescription antibiotics are toxins, and herbs are toxins. All right. Now, herbal prescriptions or herbal antibiotics tend to be less toxic than prescription antibiotics, but they still are toxins. All right. Now, are you going to hurt yourself necessarily, though, by being on these if you don't need to be on them? Probably not. The major ramification, though, of being on herbs, the herb germ killers at least, is even though they tend not to knock down the bacteria that live in your intestines, the good bacteria that live in your intestines, as easily as prescription antibiotics, they still can. Okay. And those good bacteria in your gut provide a lot of valuable function in digestion and actually immune system regulation too. So if you're taking something you don't need, you may potentially alter the bacteria in your gut, which may potentially down the road lead to some digestion issues, as well as maybe dysfunction of your immune system as the bacteria in the gut relate to your immune system. Okay. So it's not benign to take things, but if you have enough reasons to think you have it, give it a try. I think it's worth the risk then. All right. All right. So let me show you. I'm going to do a quick screen share of the Treat Lyme book here. All right. So this is the Treat Lyme book. And the Treat Lyme book, as many of you know, is my Lyme disease information site. I call it a book because it's pretty comprehensive. You can only read it online, though. All right. And so if you want to subscribe to it, basically what you wind up doing is you wind up reading the book. So if you do want to subscribe, you would go ahead and click on the About page here. You can click the Buy Now button here. Or another way is to look at the chapters of the book. And I'm going to point you towards the one that I'm coming here to look at is this chapter called How to Diagnose. All right. So in this chapter, there is an article about how to diagnose chronic Lyme disease. It's more than a test. And I lead you through in a 15-minute video in more detail what the symptoms are and what we're looking for to make that diagnosis. And again, you don't have to have a positive test to make the diagnosis. There's an article here on how to diagnose Babesia where I walk you through the various symptoms that would suggest you have a Babesia infection. And then finally, if you're trying to figure out if you have Bartonella, take a look at this article called It Could Be Bartonella or Babesia, the Signs and Symptoms. Okay, so those are some things I'd take a look at. If you're not subscribed to the book, when you click on an article, you're going to be asked, you're going to start reading the article, and then you're eventually going to be asked actually to subscribe. All right, so I just want to let you know that. All right, let me go back here. All right, so Sarah, I think the biggest risk is side effects of things that you may not need to be on, or altering the good bacteria that make up your intestines. Okay, that's your risk. But if you have enough stuff that says, I think I have those germs, I think it's worth going ahead, moving forward, and doing the treatment for it. Okay, all right. Good luck to you. Hello, Pamela C. Good evening, Dr. Ross. I have been treated for Lyme over the past 2+ years with various herbs, etc. Went off all meds last fall and seemed to relapse, spiking blood pressure, SIBO again, feeling tired. How and when can I be sure my infection is gone? Just recently seeing a LLD in somewhere. Hold on, let me see if I can find the rest of your question there. Just a minute. Well, Pamela, I can't see where the rest of your question is. Let me see here. All right. So I'm just going to be able to give you some observations here because I would need to know more specifically about your specific situation by asking you a bunch of questions to come up with the best answer for you about the best way for you to proceed here. Okay. But there are a couple observations. Number one, when I have a patient of mine that I'm treating and we get them into remission, a good place, and we stop antibiotics or we stop herbal antibiotics, and then they go on to relapse, one of the first things I always consider is it possible they might have too many yeast that moved in, set up shop in the intestines, okay? So when you get too many yeast in your intestines, they trigger inflammation inflammation chemicals to be made by white blood cells. Those are called cytokines. And those cytokines give you the symptoms that are Lyme symptoms, all right? So when you also have Lyme in you, the reason you feel poorly is white blood cells produce a group of chemicals called cytokines. Those cytokines are good and bad, okay? On the good side, they turn the immune system on. On the bad side, when they're made in excess, as they often are in Lyme disease, because the immune system doesn't do a good job and it keeps trying harder and harder, when they're made in excess, they trigger, they give you most of your Lyme symptoms. So those excess cytokines make it so you can't think, they make it so you can't sleep, they can interfere with how your hormonal systems work, they give you fatigue, they make you hurt all over, etc. What we call Lyme disease symptoms are really excess cytokine symptoms, okay? So when you've been doing better and then you decline and you've been on antibiotics or herbal antibiotics, even if it was half a year or a year ago, you are a big setup for getting too many yeast growing in your intestines. So the first thing I always want to consider before I jump back on the bandwagon of putting you on antibiotics or herbal antibiotics for Lyme is I'm going to consider, is there yeast, all right? So things that indicate you could have yeast, one is increased sugar cravings. Another one is a lot of gassiness or bloating in your intestines. If you're a woman having vaginal itching or vaginal discharge, sometimes having too many yeast can lead to acne or even skin rashes developing as well too, okay? So those are things that are gonna make me think about too many yeast or even having thrush in your mouth, white patches of yeast growing in your mouth, okay? So if you have those, the first thing you want to do is treat your yeast and not go after your Lyme, okay? All right. Is there a test that we can do that says Lyme is active? And I know a number of my colleagues do things, but the bottom line is there is not a test we can do that says when you get worse that it's Lyme that has gotten active, okay? All right, so let me walk you through that one, all right? So I know, for instance, I just saw a person in my office today where her Lyme specialist said that because her Western blot is positive again, that it means Lyme is active. And I flat out disagree with that statement, because here's why. When you've had Lyme in you for a year or more, even when we get you well, that germ probably is still living in you, right? For most people, once you've had Lyme in you for a year or more, we are not getting every germ out. It is still going to be in you, okay? So that means that when you're even in a healthy period, you may still have a positive Western blot. The other thing is, even when you are in a healthy period, the Western blot sometimes will become positive and sometimes it will be negative, okay? Or Lyme testing will sometimes be positive, sometimes negative, all right? So it makes no sense, given that Lyme is still in you, to consider that a positive Western blot means that suddenly your germ has gotten active. It just may be that you've got a positive Western blot because Lyme is still living in you, okay? So it doesn't prove that it's gotten active, all right? I know some of my colleagues will also measure something called a CD57 count. Well, CD57 is a type of test that, a white blood cell count, that can be low about 80% of the time that a person has Lyme, but often, even when you treat Lyme, it doesn't go back to normal. So if we go and test that, that doesn't prove that Lyme is active. In addition, there may be other causes for it to be low. So measuring that it's low doesn't prove Lyme is active, okay? So I make my decisions to treat for Lyme being active based on what the symptoms tell me, and also making sure that there are not too many yeast based on what the symptoms say too, okay? All right, so I'm gonna do a quick screen share here for you, Pamela. And also anyone that's listening in here tonight too. All right, so we're back in the Treat Lyme book. I'm going to look at this chapter that I have called yeast, okay? You're going to find it in the germ control and more. All right, so in this chapter, there's an article here that says a silent problem, do you have yeast? You could read that for more information about how to diagnose yeast and the various problems that it causes, okay? And then in terms of if you think you have yeast, what should you do? What are the best approaches to manage yeast? Take a look at this article called Kills Yeast, a Brief Guide, okay? All right, that will give you some good information there, all right? Okay, so let me go back here. Trying to go back. There we are. Okay. All right. Good luck to you, Pamela. I hope that gave you some insights. Okay, so the big thing I want to just make about Pamela, again, that I want to make that comes out of Pamela's question, the big point is Lyme symptoms are too many cytokine symptoms, okay? So when you have Lyme disease, you have to think of what's causing the cytokines. So it could be Lyme. It could be too many yeast in your intestines. It could be mold toxicity issues where you breathed mold toxins in and you happen to be one of 25% of people that can't get mold toxins out, okay? All right, so we have to think broadly, what's causing those cytokines? And it's not always Lyme. So for instance, I've got a patient of mine that had a tick bite, had a solid Western blot test, and we treated for Lyme, but really didn't get any better for years, okay? For about 2 or 3 years, I treated her, all right? Finally, this is around the time I was learning about mold toxicity illness. We went and gave her a medicine to treat for mold toxicity illness. And then suddenly, after having done that, then she got 100% better. And when we went back and relooked at her history, at the time she got her tick bite and a bullseye rash and a positive Lyme test, she was living in a building that had black mold growing on the walls, all right? And what had probably happened in retrospect is she breathed in all of those mold toxins, and she was one of 25% of people that can't get mold toxins out. And it was the mold toxins that were triggering her cytokines that were giving her all these severe symptoms, all right? And in the end, when I finally figured that out around the time I was learning about this stuff, that's when she got better. It was by going after the mold. There are some patients in my practice that if they come in and I think they have mold toxicity issues and they have Lyme, I may go after the mold toxicity first. And occasionally you don't even need to treat the Lyme. All right. Okay. So what about mold toxicity issues? I'm not going to go into all of it right now, but there is an article that you can look at in the Treat Lyme book, because you need to consider, is there mold? Okay. And so let's see here. Look under chapters and look under my detoxification and this article called Mold and Lyme Toxins, okay? Mold toxin illness. Take a look at it. It talks about when do you consider it, how do you diagnose it? Because again, this is an illness that can look exactly like Lyme disease does, all right? All right, let me go back here. All right, let's see here. Hello, Sandy. Let's see. Bear with me here just a minute, guys. I just got texted that I have to look at here. And I do have to respond. Just a second here, I'm sorry. Okay, so have you heard of the Lyme-provoked PCR urine test through DNA connections in Colorado Springs? Yes, I have, and I'm very concerned about DNA connections. I know that they did a presentation to ILADS, the International Lyme Associated Disease Society Conference in November. I know a lot of people in Oregon, for instance, that I see are coming in with these tests. I am very skeptical of this lab. And I know they don't want to hear that, but I gave a call to talk to them, and I actually wound up talking to one of their physicians maybe a month and a half ago. And my concern is I'm seeing people that have these DNA connections tests that says they have DNA of Bartonella or Babesia that have absolutely no symptoms of those illnesses, and I see it quite frequently. And so it had me questioning what's the validity of their test. So whenever somebody does a test, when they develop a test, they're supposed to do something called validation studies, where they take their test and they try to figure out, does it actually find known cases that we can prove through other means of the illness, okay? So for instance, there is a Lyme disease blood culture now that's out on the market for about 3 or 4 years called, run by a lab called Advanced Laboratory Services, all right? And before, as they were starting to introduce their tests, they went and did a validation study. And in their validation study, to figure out if their Lyme culture actually truly was accurate, they included people that had been diagnosed as having Lyme by the Center Disease Control Standards, which means they had to have a Western blot that was positive and enough risk factors and symptoms by CDC standards to prove they had Lyme. Okay, so they took about 47 people or so were in their study that were known to have Lyme by some defined standard. Then they went ahead and tested them to see, did their culture pick it up? All right, and their culture picked it up about 95% of the time. All right, now in the real world, I don't think their test actually finds Lyme 95% of the time for some other reasons, okay? But at least they were able to say, based on some gold standard, that their test worked, okay? All right, so here's the problem with DNA connections. They haven't done any validation studies at all, all right? This is really bad medicine. They're out there doing a test that they have not verified is accurate, okay? So clinically, when I work with a test like this, I'm always skeptical, thinking, is it an accurate, is it a valid test, all right? So when I look at their testing when it comes to the Bartonella babesia co-infections, I am really skeptical. I just do not see clinical patterns that match what I should be seeing if they really had those infections, okay? Most of the time, all right? When it comes to their testing for Lyme, maybe it's accurate. I don't know. I know that I see enough of the times that they come positive and I see symptoms and a history that builds the case for having Lyme that I think that maybe their Western blot test is accurate. Now, when I talk to their physician that I talked to about how do they know their test is valid, what I was told is that they think it's valid because practitioners are reporting to them that the test matches what they see in the patient, right? Well, I got to tell you, I'm not one of those people because that is not what's happening in my practice. I just really am concerned about the accuracy of this test. Now, I may be wrong, but they have to go ahead and prove that to me, and they haven't done their validation studies, okay? So this is what I call bad medicine, all right? And so I don't like using that test for that reason, all right? So anyhow, there's my opinion on that. All right. Thank you for that question, Sandy. Hello, Brenda. Let's see. Dr. Ross, I'm grateful for your help. Thank you for saying that. I have Lyme and Bartonella, and I would like to know how much success you have had with low-dose naltrexone. What are the risks? I am concerned to interfere with my sleep, which I desperately need. Okay, so I like low-dose naltrexone, but it only really helps maybe about 10 to 15% of the time. Okay, I'm just going to say that, all right? So everyone, I have a whole article in the Treat Lyme book if you want to read more about it too, but let me just say a few things briefly about it, all right? So naltrexone is a prescription medicine that is used to block narcotics. So it was designed for people that are having drug overdoses, okay? Because what it would do is they'd come in with the overdosed on heroin, and we'd inject in them or have them take naltrexone, and it binds to the receptors where those narcotics are binding, booting them off, and then suddenly they're not having the overdose effect anymore, all right? All right, now, when we use it in Lyme, we use it as something called low-dose naltrexone, all right? So why do we use it that way? Well, so it's manufactured as a 50 milligram pill. And when we use it to get benefit in Lyme or in autoimmune illnesses where the immune system attacks you, we find that it works best at a dose of 1.5 to 4.5 milligrams a day. Okay, that's called low dose naltrexone, all right? And that has to be manufactured by a compounding pharmacy. It's not made by regular pharmaceutical companies, so you have to go to a compounding pharmacist that mixes this up for you, okay? All right, now, what does it do? All right, so we have a natural narcotic system in us called endorphins. We make a group of chemicals called endorphins. And endorphins help with pain, but they also regulate the immune system. So the naltrexone binds to endorphin receptors, which are also narcotic receptors, okay? So what happens is the brain, if it senses that the endorphin receptors in the body are blocked, it doesn't like that. And it sends out a bunch of chemicals to the endorphin producing cells in the bodies to make more endorphins. So what happens is they do. And when the naltrexone wears away from those receptors, and when it finally wears off, those receptors get flooded with all these extra endorphins. And that has the effect of regulating the immune system. Okay? All right. So there are 4 conditions. Oh, and so why do we make it low dose then? Why not just give a 50 milligram pill? Well, the reason is that 50 milligram pill would never wear off. Versus this blockade provided by a 1.5 to a 4.5 milligram pill, it's going to hang out for about 4 to 6 hours, and then it will wear away. And it's at that kind of time that to get flooded by these extra endorphins, that's when we get the most benefit. All right. So 50 milligrams would do too long of a blockade, basically. Okay. So that's why we go with the low dose. Okay. Now, what do we know from science about this stuff? Right. So, there are 4 autoimmune illnesses where we know the immune system attacks a person, causing the illness, that for which there has been benefit shown by low-dose naltrexone. And those 4 conditions are multiple sclerosis, something called Crohn's disease, which is an arthritis condition of the intestines, Hashimoto's thyroiditis, which is an inflammatory condition of your thyroid gland that at first can cause high thyroid and eventually causes low thyroid, okay? And then finally, fibromyalgia, which, fibromyalgia, a lot of muscle aching as well. That sounds pretty similar to Lyme, doesn't it? So anyhow, those are the 4 conditions. And they're limited studies. They're not the greatest studies, but at least we get some evidence that maybe it will make a difference, all right? Now, when you have Lyme disease, part of the reason that for some people, having the Lyme infection in them will trigger the immune system to attack you like an autoimmune illness, like rheumatoid arthritis or similar to lupus, those kind of illnesses, okay? But it's not in everyone. Now, the infectious disease doctors will tell us that it's a large number of those people with Lyme, that it really is due to the immune system reacting against the germ and triggering an autoimmune illness, all right? And they're not all wrong in that opinion, but they think it's too many people. I think from what I see, maybe about 10 to 15%. There's not a test to say, is your Lyme causing autoimmune illness? We don't have a test that proves that, all right? But what I will do at a point, if I've got somebody that's not getting better with their illness and they're 6 to 9 months in, one of the additional treatments that I'm going to consider trying for 2 to 3 months is low-dose naltrexone. And the way that you dose it is 1.5 milligram pill is how you start. And I have people take it in the morning. I know you've read to take it at night, but I'll come to that in a minute. 1.5 milligrams in the morning, daily for 2 weeks. Then you go up to 3 milligrams daily for 2 weeks, and then up to 4.5 milligrams. Be on the 4.5 milligram dose for at least 2 months to see if it's going to work. If you get benefit, continue it. If you get no benefit, stop it. It's not going to work for you. So again, I think it helps about 10 to 15% of people based on my clinical experience, okay? All right, so I know that there are some information out there that says take it at night to get the best effect. Well, the trouble is, in a lot of people, that causes insomnia. So I have people take it in the morning, and I still see good benefit, all right? So I disagree with the people that say you have to take it at nighttime. So take it in the morning to avoid the insomnia, all right? Are there any risks? No. I mean, the biggest one is insomnia. The other thing I see rarely, and maybe 1 to 2 people out of 100 that I've tried this on, or a rate of 1 to 2 people per 100, you might get some confusion that occurs in some people, or a dizziness or cloudiness, but it's only been like 1 or 2% of people, okay? And you'll know if it is, then stop it. It's not a permanent injury that it causes, all right? Okay. All right, Brenda, thank you for that question. I hope that gave you an answer. And then let me show you, if you want to read more about this, let me just do a quick screen share here. All right, so this is the Treat Lyme book. I'm going to look at the chapter section here. And this is something you'll find in the immune system chapter. And let's see. Take a look. Either one of these articles will give the information. So either this article called When Your Immune System Causes Lyme, or and that should, I probably should change it. It should be When Your Immune System Causes Lyme Symptoms, okay? Or on low dose naltrexone and Lyme, does it help? Either one of these is going to give you the information you need, okay? All right. And in there, I give you the citation of the research that's been done on it as well, too. Oops, let me try to get back here. All right. So thank you for that question, Brenda, and good luck to you. Hello, Victoria C. Hi, Dr. Ross. I'm getting frequent sore throats for a long time now. I have Lyme and positive ANA. Is there anything to do to stop them, and what causes them? I take S&B supplements, low-dose naltrexone, cannabis, curcumin, probiotics. Thank you. Just a minute. As I said, I'm getting over something here today. So one of the things I think of when people get repeat sore throat infections, and this would be something for you to explore, is I see that happen often when people have Bartonella. All right. So you might want to look at the article I have on how to diagnose Bartonella. You'll find it in the Bartonella chapter, or on the how to diagnose chapter. I showed you that earlier. Read through that symptom list and see if you have enough things to say Bartonella. If you do, I treat for the Bartonella. Okay. All right. And those are the only thoughts I really have for that. Good luck to you, Victoria. Thank you for that question. Hello, Brenda. Let's see. Do you use colloidal silver in your treatment for Lyme? If so, how effective has it been, and how long have you prescribed it for? So, Brenda, I don't use it as part of my treatments. I do see people that have gotten benefit from it, but my observation from people that come to see me that have tried it, and that's the best I can give you, is my observation on people that have tried it, is it may work about 40% of the time. One of the concerns I have about it is that you can, when you use colloidal silver, as you take the silver, microscopic amounts of silver, it does build up in you, okay? And depending on the product you use, there is a lifetime maximum you can take, because you might turn blue, literally. The stuff deposits in your skin and you can turn blue, all right? I think there are better treatments to do besides colloidal silver. I'd take a look, for instance, at the Banderol Cemento that I recommend as part of the successful treatment recipe, my Lyme disease treatment protocol, my guideline. If you do all of those steps and you use that Banderol Cemento I recommend in there, you're going to do much better than being on a colloidal silver. You have a better chance of good outcome, okay? And you don't risk the problems that you're going to run into of possibly turning blue. And once you turn blue, it's not going away. You're going to stay that color of blue too, okay? All right, let me just do a quick screen share here. All right, so this is back in the Treat Lyme book, okay? My treatment protocol you can find right here under the tab that says Treatment Protocol. All right, and in it, I lay out my successful treatment recipe, all right? And it talks about getting sleep and what you can do for that. My preferred diet, which is a paleo type diet I mentioned in here. Lowering cytokine inflammation chemicals that get made by your white blood cells. Remember, I talked about those earlier tonight. Those cytokines give you most of your Lyme symptoms, but they also suppress your immune system. So you want to lower them. And what I like to use for that is curcumin. I also like to have people be on something called an adaptogen. These are herbs that help your body deal with the stress of this illness. And my favorite is something called ashwagandha. I like to correct hormonal problems, and I talk about how you can figure that out here, and even steps you can take without help of your physician. I like people to be on a good multivitamin. I like to make sure there's not yeast there, all right? And I talked to you here about how to figure out if they're there. Remember, I talked earlier tonight that if you have too many yeast, they're going to kick up cytokines, okay? There's a screening questionnaire that you can click right here. I'm running my mouse over it. And click on that. If you score over 140, there's a good chance you have too many yeast, okay? And then in here, part 8, treat your Lyme infection. Notice it's the 8th part. All these other steps up above are just as important. You've got to correct all these other problems to get over Lyme, okay? And in here I talk about Otoba bark extract and cat's claw. Otoba is banderol, cat's claw is cemento. These are about the only two herbs within the Cowden protocol that I think work, okay? And these, according to Petri dish experiments, work really well at getting rid of Lyme. And then based on my clinical experience, I find they help about 85 to 90% of the time. They can be as good as prescription antibiotics, okay? All right, do some basic detox steps, treat your co-infections if they're there. And then anyhow, take a look here. This is my whole treatment guideline, okay? You want to make sure you're doing all of the essential steps that I outlined here. It's not as simple as just poisoning your germs with antibiotics, whether they're herbal or prescription. You got to do more steps than that to get better, okay? All right. Thanks for that question, Brenda. Good luck to you. Hello, Sheila. See, have you tried Dapsone with any of your patients or having trouble getting well? If so, what have been your results? So, Sheila, I have with a limited number of people, and it's a hard drug. That's what I would say. I'm going to be giving it a try again. I'm going to be following a little bit more closely the guidelines of Dr. Horowitz. But one of the things that Horowitz talks about now so Dr. Horowitz is the physician that came up with the idea of using Dapsone. He observed that Dapsone is a drug that we use in people with leprosy. And leprosy is known to have a condition called persister cells, which is Lyme, that some of the Lyme germs slow down their growth really, really slow their metabolism way down, and they stop responding to antibiotics. There are some Petri dish experiments that suggest that on Petri dishes, at least 20% of Lyme germs will, after they've been exposed on and on to antibiotics, become persister cells, all right? And that is the same situation that can happen in leprosy. So Dr. Horowitz was thinking, why not try the leprosy drug and see if it would make a difference here, okay? And so he did publish a study that came back, I think, in December of 2016 of 100 different people. And he showed about maybe, I think it was 60 or 70% of people get improvements by being on the Dapsone. What he wasn't so clear about in his article, though, is how hard this drug is, okay? So now in his lectures, he talks more about his experience, all right? So what happens with Dapsone is you can get some pretty severe Herx reactions. So if you're going to do it, you have to start low and slow. So you try to work up to at least 50 to 100 milligrams a day, but often you want to start at about 25 milligrams every other day for a week, then go to 25 milligrams a day for a week, then to 50 milligrams alternating with 25 milligrams for a week, and then eventually up to 50 milligrams a day for a week. Now, he thinks in his experience that 50 milligrams is the minimal effective dose. You got to at least get up to that level, okay? And when he uses it, you have to combine it also with other intracellular antibiotics, like rifampin, for instance, or Bactrim, for instance, or Biaxin, for instance, or the tetracyclines, for instance, okay? So he did use it occasionally by itself, but he used it also combined with other drugs, all right? Now, here's the problem with Dapsone, a few problems. Number one, its side effects look like a Herx reaction. So when you've got somebody getting worse on it, I could not tell the times I've done it with maybe about 10 patients as to whether it was a Herx that was hurting them or whether it was the side effect of the drug, okay? Now, I'm going to be starting more people on it again after I've watched some of his lectures about it, and I will be trying it again. But I'm going to start low and slow. That's the first thing, okay? All right. Secondly, if you're going to do it, you cannot use oxidizing agent medicine. So you cannot do ozone therapy, hydrogen peroxide treatments, high-dose vitamin C, or even hyperbaric oxygen. That will just make this stuff really hard to do, all right? So don't do that. Third thing is before you do it, you got to get a blood test called G6PD, all right? That's an antioxidant that's made in our red blood cells. And if you are deficient in that, being on this could cause anemia, hemolytic anemia, where your red blood cells break apart, okay? All right. Now, the other thing that happens with this is when you're on it, you need, what he has found, and I would agree with this, is being on glutathione helps with some of the Herxheimer reaction that happens. So I like to have people on Trifortify Orange or Trifortify Watermelon by Research Nutritionalists. This is a liposomal glutathione. 5 milliliters one time a day, all right? The other thing is the dapsone interferes with the metabolism of folic acid and its use to make your red blood cells. And so you have to take a lot of it. And he suggests taking up to 15 milligrams of it a day to keep yourself from developing anemia from it, the folic acid not adequately being used while you're on dapsone, okay? And then finally, there's a person periodically that will get winded on this, and that is because the dapsone turns some of the protein in your red blood cells that carry oxygen, called hemoglobin, it turns them into a methylated hemoglobin, which will not bind oxygen to carry it through you. And so you want to try to keep that methyl hemoglobin below 10%. Between 5 and 10%, you might start getting winded, okay? Now, so what I want to let you know, it's a hard drug. You've got to make sure that you're working with somebody that's going to monitor you about getting winded, make sure they put you on good folic acid. You got to start slow on this stuff. Do not be on any oxidizing agents at the same time. It's just going to make it a total mess. And go really low and slow. And that was my big lesson that I learned as I tried it a number of patients, and I am going to be going back to try it again. Okay. Now, the dapsone is the only medicine that has human research to say it might help. And again, I think his research says maybe 60%. I have to go back and look at that again. I'm preparing to write an article about this, by the way, which is how I know this stuff off the top of my head. All right, now, dapsone, in terms of drugs for persister Lyme, is the only one that has been researched in humans, all right? So this idea of persister Lyme is starting to get a lot of discussion among Lyme doctors as maybe the reason we have a hard time getting people well. And there is a physician named Dr. Zhang who has been doing a lot of looking into this, but more at a petri dish level, okay? Now, on petri dish experiments, there are some things, drug combinations that have been shown to be effective against persister Lyme, but they haven't been tried in humans, okay? And so I am starting to try one of these. And one of these is a combination of Bactrim, doxycycline, and cefuroxime. This appears to be a good combination for persister Lyme, and I am just starting to put some people on that to see if what my clinical observation is as to whether it's going to make a difference for their persister Lyme or not, okay? Dr. Zhang has also published some other research, and many of you may have seen it before, that says a drug called cefoperazone, along with, I just blanked on the other ones. You will see this. The article should be ready within the week or so that I'm writing about this. But the problem is, in his other research that used the drug cefoperazone, it is not available here in the States. Okay, so in place of that, you would need to use actually the cefuroxime I was just telling you about. Also, in his triple drug protocol, one of the drugs is used to treat skin infections from methicillin-resistant staph. And it's expensive, only available IV, and it's probably not going to be covered by any insurance company. So his other leading work that showed 3 drugs are really good is not doable for most patients. It can't be covered. But these other 3 antibiotics I was just telling you about, the combination of doxy, along with Bactrim, along with cefuroxime, may be a doable combination, and I'm just starting to work with that with some of my patients. I'm talking to you off the top of my head. I'm in the process of preparing an article, which you should see out probably within the week. That's what my goal is, at least within the week, is to have an article about antibiotic treatments for persister Lyme, and I'll include some information about dapsone in that as well too. All right. I hope that answers your question, Sheila. Good luck to you. Hello, Val. Let's see. Husband being treated for chronic Lyme, Bart and Bab, now having stiffness, rigidity in hands, grasping behavior, arms and upper torso. Any suggestion to treat these symptoms? All right. So when I think of, first of all, I'm thinking to see if there might be drug effect, side effect of the things I know that treat Bart Babesia. What I would do, review his medicines. There are a few medicines that we use for Bart, Babesia, and Lyme that can concentrate really heavily around the nerves in the brain, and which can be good because it gets where we want it to be to kill things. But sometimes it causes irritation of the nervous system that could give symptoms of stiffness like this, okay? And those are minocycline, which is a tetracycline. I love it because it crosses the blood-brain barrier. It's very fat soluble. But the trouble is, in some people, it will give a nervous system irritation, okay? The other drugs we use for babesia that can do something like this too are malorone and mepron. The key related ingredient to both of those is atovaquone. Okay, so mepron is 100% atovaquone. Malorone is atovaquone with proquinol, which is a quinine-like medicine. Okay, all right. Quinine and quinine-like medicines, which is plaquenil, proquinol, and malorone, and quinine, which sometimes is used to help with treating babesia, can also give neurologic symptoms like this too, okay? So first of all, review the medications and see if he's on any of these. If he is, you may want to pull back on them, okay, or get off of them, okay? All right, second thing you can do when you get stiffness like this, it often can mean some kind of a dysfunction within the mitochondria system of the body, all right? So your mitochondria are the energy factories that are found in every one of our cells. If they get injured, they can't generate enough energy to make the nerves work, all right? You can get stiffness for that, for instance. If they get injured, we have low energy. If they get injured, we may hurt all over. We may not think correctly, all right? So what you might want to consider doing is doing some mitochondria repair work. I have a whole article about that too if you want to read it in more detail. But one of the key ingredients about doing mitochondria repair is to fix the fat membrane of the mitochondria, all right? So there's 300 to 400 mitochondria in a cell. And what happens is fat and sugar are carried to the inside of the mitochondria where they're burned through a bunch of chemical reactions into cell fuel, all right? We call that ATP as the cell fuel. If they get injured, you can't carry the fat and sugar to the inside. Secondly, that healthy covering donates a bunch of electrons to chemical reactions in the mitochondria that create energy. And if it's injured, it can't donate the electrons, all right? So you can repair the covering by using something called NT factor energy. It's made by a company called Research Nutritionals. It's made up of those fats, 2 pills 3 times a day for 2 months, then decrease it to 1 pill 3 times a day for 4 months, okay? All right. There's been studies done regarding energy and thinking about it. And the studies show that there are average energy improvements of 40% by 2 months of using this. And there is improved clearer thinking is what people reported. That was the end point. They reported clearer thinking. Okay. All right. The other thing I would do if you are not treating babesia with mepron or with malorone, you can take CoQ10. So I would get on CoQ10, which helps carry electrons around the mitochondria. I would be on CoQ10, 400 milligrams, 1 pill twice a day, all right? Finally, the third thing I would do is get on glutathione. And I like using the Trifortify Orange or Trifortify Watermelon by Research Nutritionals, which is liposomal glutathione. I would do 5 milliliters of that 1 time a day, all right? I'm going to do a quick screen share. I'm going to show you a few things here, okay? All right, so let's see here. All right, so back in the Treat Lyme book again. This is my treatment protocol. I showed that to you earlier. All right, so what I want to do, I'm going to look here in the brain and nerves chapter and take yeah, I guess to get the information I was just talking about, you might want to look at this article called Brain Fog in Lyme Disease. You can fix it, okay? And I talk about mitochondria injury and that. Let's see here. Yeah, so that will have a lot of information about the mitochondria injury, but then also, let's see, where else would I put that? There it is. This article called Power Up Energy and Mitochondria. Read this. This has all that information I was just telling you about too. Okay, so I would wind up doing that. All right, and then in terms of these supplements I keep recommending, I just want to show everyone, this is my Lyme disease supplement store. And the reason I run this store is because my patients ask me, where can they get good stuff? Because most supplements that are out there that you even get at supplement stores are not that high quality. the brands that I choose here in my supplement store are ones for which I know the manufacturers do a good job selecting the most active ingredients, the best quality ingredients. And also these are products that tend not to have a lot of or don't have fillers in them that may harm you. Okay, all right. So if you're wondering, when I talk generically in the Treat Lyme book about a product I'm using, you could look on my site here to see what do I use, what do I have. So for instance, if you're having mast cell allergic problems, one herb I like to use is something called quercetin. You could just type it in here, quercetin, and you could see what products do I have that have quercetin in them. Okay, all right. And then that would give you an idea of what do I think is a good product, all right. Now, I mentioned earlier research nutritionals as having the main products you would want to use to fix your husband's stiffness, okay? All right, and so this is the research nutritionals page. You can find it under supplements, go down by manufacturer, and there's the research nutritionals, okay? So for instance, this is the CoQ10 I like to use. It's a 400 milligram pill 2 times a day, all right? And this is the Trifortify Orange, which is that glutathione product I was just mentioning. That's what I like to use for that. And then the NT factor, where are you here? There's the NT factor energy that I was just telling you about. Okay, all right. So there you go. Let me go back here. All right, so that's where you can find some of the information or products that I'm recommending tonight as well too. All right, Val, good luck to your husband. Start by looking at medication side effects first, okay? If those aren't a problem, then start doing some mitochondrial repair work, especially get that glutathione in, get the CoQ10 in, get the NT factor in, okay? All right, good luck to you. Good luck to your husband too. Hello, Debbie. Let's see. Hello, Dr. Ross. I wonder what your thoughts are on a relationship between Lyme disease and dental cavitations. A 3D x-ray recently showed bone density problems in my jaw, and the dentist wants to do cavitation surgery. I'm reluctant to do this as so little is known about this. I'm also afraid. So the cavitations could is the big word here, okay? Could be a place where Lyme is hanging out. Okay, it could become a pocket of Lyme infection, all right? One of the approaches that I like to use when people have cavitations, I like working with a dentist here in town that thinks way outside the box, okay? He works alternatively. And what he'll do is he'll do ozone injections into those cavitations. So you don't need surgery. What you can have done is you can actually just inject ozone into those areas, and that would kill the germs, okay? So that's something for you to think about, is if you can find a dentist that works a little bit more alternatively, okay? But yeah, the cavitations can be a problem. They can actually be a place where Lyme is living and continuing to trigger problems for you. Sometimes it's hard to get the antibiotics in there, okay? All right, good luck to you. Hello, Jacqueline. Let's see. I'm a 53-year-old mother of 3. My 2 oldest recently tested positive for Lyme as well. I thought I had MS for years, but now being treated for Lyme. My youngest has unexplained depression and being treated for unexplained gastritis. Her Lyme test negative, but could it be Lyme since we all have it too? So let me see here, my youngest. So to answer your question, yes, it could be. But I would need to know a lot more about symptoms before I could help you figure out if there was really a high probability of that, okay? So keep in mind with, I showed you tonight earlier an article, go to the How to Diagnose chapter. There's an article about how to diagnose Lyme. Look through there, you'll see that you can still diagnose Lyme even if you don't have a positive test. It's a 15-minute video article where I walk you through the steps to help figure out, could it be Lyme? Okay, just go through that, see if it makes sense for your youngest child, okay? That would be one place to start, or have a visit with me. And you can do that without flying all the way out here to Seattle, Washington to see me. You can visit with me online. And I'll show you in a minute how you get that set up. The only problem with those online visits, I can't order tests and I can't order antibiotics for you. I can write a note. I do write a note that you can show your doctor. And if you need prescriptions, maybe you can talk your physician into it. I can tell you which herbs to use, but my medical board will not let me prescribe things without first seeing somebody in the office. Okay, so that's the only problem with it. So could it be Lyme? Yeah. So what the issue is with Lyme, according to pregnancy registries that were kept about out on the East Coast of the United States in the late 80s, early 90s, about 50% of women that have Lyme during pregnancy can transmit it during pregnancy, okay? That's based on those pregnancy registry studies. So that means that your youngest has a 50% chance of having it, but they also have a 50% chance of not having it. And we can't get so caught up in putting our Lyme blinders on stuff to say that everything is Lyme. We have to make sure there aren't other things that give symptoms like this as well too, okay? Let me just do a quick screen share because I want to show you how, if you are interested in getting more input from me that's specific to your youngest, how you would go about doing that. All right, so I'm going back in. This is the Treat Lyme book again at www.treatlyme.net. Take a look at my online consult tab here, okay? And read through here, read all the way through here. So even the section about how it works and the disclaimer, and see if this is for you, okay? If you are interested in setting up an appointment or hearing more about it directly, you can call Christine, who is my right hand here, and that's the number you would call her, 800-470-7217. She can answer more questions, or you can write to us and she'll get back to you via email on that, okay? All right, let me go back here. Trying to go back here. All right, so Jacqueline, thank you for that question. All right. So that, as I mentioned tonight, I'm actually fighting something right now that I'm keeping at bay, but I know that after an hour I start pooping out with these webinars and I'm pooped out. So I am only doing an hour webinar tonight so that I can go home and take care of myself so that I can be here for my patients tomorrow. So it's a 1 hour webinar tonight. In a second here, I'm going to, as I terminate the webinar, you're going to be directed over to the Treat Lyme book, okay? You will be taken there. Your web browser will take you there, all right? And if you want to sign up for next week's webinar, I encourage you to do so. I plan on an 1.5 hour webinar next week. And you can do that through the webinars tab at the top, okay? I think many of you are familiar with my website. You signed up, obviously, for tonight's webinar, all right? And then also, when you're there, if you want to, I appreciate when anyone subscribes to the Treat Lyme book. You support this work that I'm doing here, including these free webinars, all right? And so that makes it so that I'm available to help others that may not have resources to. So if you would subscribe to the Treat Lyme book, I'd appreciate it. And as many of you know, it's got some great information in it for you. So if you have questions I didn't get to tonight, read about it in the Treat Lyme book. You'll probably see, if you look through the chapters or do a search for the topic that you want to talk information on, I probably have written something about it, all right? So I encourage you to subscribe to the Treat Lyme book and support this work as well, too. It was great visiting with you tonight. I wish I felt 100% that I could do another half hour with you, but that's it for me tonight. And so I'm going to go ahead and take you over to the Treat Lyme book. Tomorrow morning, about 6:30 in the morning, Seattle time, you will get an email from me saying the recording is ready for tonight, all right? Good night, everyone.